Thanks a lot for being today with you. It's a great challenge for me to talk after Professor Mendoza, Kapnick, Janisi, and Roses, um, especially when talking about aesthetic philipology, lessons we learned. First, we have to know what is aesthetic philipology. Which one of these do you consider having result to be aesthetic? Which picture of these? So it's this or this. So ascetic philipology is mainly a private practice philipology committed to ascetic results. You have to have the best and long-term results. You have to invest in the technology and learn how to show your value with proper charge. How to start? After we had heard clinical assessment, duplex scanning are cornerstones that I will not go through. But we have visualization, photo documentation, go modern and minimize complication and follow-up. First, the visualization. I think augmented reality is a very important stone in our results. You have to know how to see the veins to put a proper plan for treatment. Also, it's very important for the follow-up. Photo documentation, which is mandatory, and you will see why it's mandatory. You have to use a camera, not your mobile phone. You have to use a dedicated flash and to be directed upward. You have to have a dedicated room with white room walls. You have to do with and without augmented reality pictures before, during, and after session, and not less than 30 pictures per session. You have to put in different views, in different positions, marking the working space that you will work on, because it's very important to know where have you worked in the last session. Also, you have to put a cloud storage with very strong password to store your work in one folder for each patient. Follow-up is mandatory, and one clue to know why it's very important, you have to ask the patient's opinion before and after seeing his own pictures, and you will know how important it is. Going modern, go for CLACS, cryolaser and cryosclerotherapy, using Nd:YAG 1064 nanometer laser, 6 millimeter spot size, low fluence energy with pulse duration 15 to 25 millisecond. As you see in the figure, just right, not too much and not too less. Using the sclerosing agent, the best is the dextrose 75% medium power sclerosing agent. There is no study in India using dextrose 50%, and this cause less side effects with maximum limit used, with no maximum limit use. Also, skin cooling to protect the skin, reduce pain, and vein contraction is very important. So we reach synergy, not combination. Our results. This is our first success case, as you see in the picture. This is after only one session of CLACS. You can see the difference between the pre and post picture. Another case after one session. Another case. That's why documentation is very important. And in this case, we had a different technique of CLACS using the laser and foam sclerotherapy, not only the regular one, because it has two feeders in the perforators, and you can see the perfect results. You can see the picture divided, upper part with CLACS and lower part without the CLACS. Also this and this. Our results with a retrospective review of complications in 358 patients using CLACS guided by augmented reality. We had only 2 patients with pigmentation, 1 patient with matting, and 0% skin burn, cutaneous ulcer, VTE events, anaphylactic shock, and death. To conclude, Mr. Chairman, dear professors and colleagues, aesthetic philippology is the new era, putting in consideration using the most recent technology within the guidelines to achieve best outcome and longest duration, along with having the proper cost of the service. You have to invest in the future. Thanks a lot.